Question, Doc, I have knee pain and nagtakian ko actually, the patient is beside, he's limping every day. So my groin pain, sakit sa bugan, sakit sa singit, and every day the patient is limping. Now, it could be a hip pathology, most commonly osteoarthritis, AVN, or rheumatoid arthritis of the hip po. So, these are the signs of symptoms of yung hip osteoarthritis. 1, may limp yung patient. 2, the patients may have groin pain, sakit sa bugan, and referred pain to the knee. Yung pangatlo is they have knee pain that is referred from the hip. Ibig sabihin nito po, the pain that comes from the hip is felt in the knee. That is what referred pain is. The knee is not the cause of the pain, but you feel it there. If you have these 3 signs and symptoms, it's very possible na may problem sa hip. It could be AVN, and this is AVN, yung namamatay po yung hip joint. So, death to the hip joint because of a destruction in blood supply. We have a whole video and live for these hip AVN patients last week. Check that out in the Facebook page. Here is an x-ray of patients with AVN on one side compared to the normal hip on the other side po. Notice how round yung normal hip compared sa yung hip with AVN po. Also, the other cause could be arthritis of the hip. One arthritis that is common is osteoarthritis. Sakit yung bugan or yung groin. It radiates or it's referred down to the knee. The patients are limping. They think they have knee problem, but actually it's coming from the hip. So this is what osteoarthritis is. It's wear and tear to the hip joint, the ball and socket portion of the hip. And on one side, you have a normal hip. May joint space pa. There's a space in between the ball and the socket joint. And on the other side, we have severe osteoarthritis na wala ng space. And the head is slowly getting worn down po. What we do for these patients na may severe arthritis sa hips, pag in pain na talaga and they want quality of life, they want to travel and walk normally, is a total hip replacement. Again, it's a ball and socket problem. That means we need to replace the ball and we need to replace yung socket portion po. So this is a full hip replacement, ball and socket, for patients to walk immediately and get quality of life by traveling or whatever they want to do. Go to malls, go to the church, go to the market, travel abroad to their children. So these are some patients who are walking after their hip replacement. We do a direct anterior approach. That means no muscles are cut and the patients are walking right away. Again, always po, consult your doctor because not all patients are the same. Not all symptoms are the same. I always advise the patient to have a face-to-face physical exam and a good history. Be honest po with your physician po. Again, join the Facebook group. It's a public group that is free to join, Hip and Knee Arthritis Philippines. And also, you can message me in the chat group. We have a general chat that you can reach me po. Or you could set an appointment in the clinic with me, Dr. Joff. And they're Monday and Friday, 10 to